Thank you, Mr. President, for allowing me the opportunity to speak. My name is Brandy L. Lane, and I am a registered nurse. Hopefully, today I will be representing the 2.7 million registered nurses that are in the United States, constituting the largest healthcare occupation in the U.S., according to the U.S. Department of Labor. As a nurse, I have firsthand experience with caring for all types of patients, whether they are rich or poor, black or white, insured or uninsured. Nurses are not discriminatory in who we care for. So why should the U.S., a world leader, be discriminatory in regards to people that receive or have access to health care? Having universal health care makes total sense. According to an article written in the Bulletin of the World Health Organization, the U.S. is currently the only high-income country without nearly universal health care coverage. Take example, Japan, another high-income country. Japan introduced universal health care in 1961 and has progressively made impressive strides in improving health care. Why can't the U.S.? Everyone that spoke before me did in fact agree that we need to bridge the gap. It is already known that wealthy Americans in the middle class have access to health care. Unfortunately, elderly, low income, unemployed, and people with too many pre existing conditions are not usually so lucky. The way to bridge that gap that we all so fondly speak of would be through the expansion of Medicaid. I was born and raised in Louisiana. I still live and work in Louisiana. The hospital where I work is a level 1 trauma center that cares for and treats predominantly lower income minorities that are usually uninsured. The existence of persistent racial and ethnic disparities in insurance coverage and access to medical care is overwhelming. Reducing these disparities is a core objective of the Patient Protection and Affordable Care Act. According to the American Journal of Public Health, there was an article that featured a study that was done that took a detailed look at disparities in coverage and access to care. The data was collected from the years 2005 through 2010 and identified groups targeted by the coverage provisions of the Medicaid expansions and subsidized marketplace coverage. The data highlighted the opportunity of the Affordable Care Act to not only improve coverage, access, and use for all racial and ethnic groups, but also to narrow racial and ethnic disparities. Currently, Louisiana is ranked 50th in the nation for having the worst health, according to America's Health Rankings, as featured in an article that was written by Dr. Kavita Patel. Obviously, our current healthcare strategy is not working. A statewide expansion to access in healthcare is greatly needed. As an advanced practice registered nurse graduate student, whose goal is to one day open up a practice in Louisiana, the enactment of the Affordable Care Act will impact me directly. So, Mr. President, I just want to present to you data that will showcase the positive outcomes for Louisiana with the enactment of the Affordable Care Act. According to healthinsurance.org, under the new Medicaid expansion program, there is an estimated 375,000 people that will be newly eligible for Medicaid. Of that 375,000, there is an estimated 105,000 that will be auto-enrolled based upon Supplemental Nutrition Assistance Program SNAP data. According to the U.S. Department of Health and Human Services, there will be many health and economic benefits for Louisiana with Medicaid expansion. Greater financial security. Louisiana's decision to expand Medicaid could result in 27,000 fewer people having trouble paying other bills due to burden of medical costs. Better health. Medicaid expansion in Louisiana would lead to 26,000 additional individuals reporting being in good or better health and 18,000 fewer individuals experiencing symptoms of depression. Lower uncompensated care. Louisiana's uncompensated care costs could be $200 million lower annually with expanded coverage fully in effect. And lastly, a higher standard of living. Louisiana's decision to expand Medicaid will bring an estimated $1.1 billion into the state's economy annually. That funding boosts the standard of living of the state's residents both by improving the lives of the newly insured and by reducing the burden of uncompensated care for providers, taxpayers, and the privately insured. As a previous speaker stated, Medicare and Medicaid is the single biggest driver of our federal deficit. However, with the enactment of the Affordable Care Act and the impact that it would have on individual states, hopefully, the United States will begin to see a reduction in the $1 trillion federal deficit. Thank you for your time, Mr. President.